Post-operative instructions, wisdom teeth removal. The removal of wisdom teeth is a serious surgical procedure, and post-operative care is very important. Unnecessary pain and the complications of infection and swelling can be minimized if the following instructions are followed carefully. Essentials of care. The gauze pad placed over the surgical area should be kept in place for at least half an hour. After this time, the gauze pad should be removed and discarded. Replace the gauze if bleeding persists. Vigorous mouth rinsing, sucking, or touching the wound area following surgery should be avoided. This may initiate bleeding by causing the blood clot that is formed to become dislodged. Begin a diet of liquids and soft foods as soon as you can. Take the prescribed pain medications with food as soon as you begin to feel discomfort. This will usually coincide with the local anesthetic becoming diminished. Restrict your activities the day of surgery and resume normal activity when you feel comfortable. If you suddenly sit up or stand up from a lying position, you may become dizzy. If you are lying down following surgery, make sure you sit for 1 minute before standing. Do not smoke following surgery of any kind. Bleeding. Slight bleeding, oozing, or redness in the saliva is not uncommon. Excessive bleeding may be controlled by first rinsing or wiping away any old clots from your mouth, then placing a gauze pad over the area and biting down firmly for 30 minutes. If bleeding continues, bite on a moistened tea bag for 30 minutes. To minimize further bleeding, do not become excited. Sit upright and avoid unnecessary movement. Swelling. The swelling will not become apparent until 1 to 2 days following surgery and will not reach its maximum until 2 to 3 days post-operatively. However, the swelling may be minimized by the immediate use of ice packs. The ice pack should be left on continuously while you are awake. After 48 hours, ice has no beneficial effect. 36 hours following surgery, the application of gentle moist heat to the sides of the face is beneficial in reducing the swelling and stiffness. Sleep with your head elevated on 2 pillows for 2 to 3 nights following the procedure. Pain. Acute pain management should always start with over-the-counter pain medications, such as acetaminophen, Tylenol, or ibuprofen, Motrin, Advil. If you take the first pill before the anesthetic has worn off, you will be able to manage any discomfort better. Precede each pain pill with a small amount of food, and chances for nausea will be reduced. For severe pain, you may take your prescribed opioid narcotic. Do not take more opioid pills or more often than prescribed by your surgeon. If prescribed, Vicodin Norco may be taken every 4 to 6 hours for pain. Do not use Tylenol. If you notice that the pain medication is not providing comfort for long enough, alternate the Vicodin Norco and ibuprofen throughout the day. Do not drive or drink alcohol while you are taking opioids. Do not use opioids with benzodiazepines, sleeping medications, or other depressants. Diet. After general anesthetic or sedation, liquids should initially be taken. Advance your diet as you feel more comfortable. Try to avoid straws if possible and drink from a glass. You may eat anything soft by chewing away from the surgical sites. Very hot or very cold food should be avoided. High-calorie, high-protein intake is very important. You should prevent dehydration by drinking plenty of your favorite juice or Gatorade-type drinks regularly. Your solid food intake may be limited for the first few days. You should compensate for this by increasing your fluid intake. At least 6 to 8 glasses of water should be taken daily. You will feel better, have more strength, less discomfort, and heal faster if you continue to eat and drink. Keeping your mouth clean. No rinsing of any kind should be performed until the day following surgery. You can brush your teeth the night of surgery, but rinse gently. The day after surgery, you should begin rinsing at least 5 to 6 times a day, especially after eating, with a cup of warm water mixed with a teaspoon of salt. Discoloration. The development of black, blue, green, or yellow discoloration is a normal occurrence, which may occur 2 to 3 days post-operatively. This may also occur at the injection sites on your arm or hands. If there is pain, redness, or hardness, please contact our office. Application of moist heat to the discolored areas will speed up resolution. Antibiotics. If you have been placed on antibiotics, take the tablets or liquid as directed. It is important to take your antibiotic on a regular schedule. It is not effective to take a catch-up dose if one is missed. Antibiotics will be given to help prevent or treat active infections. Discontinue antibiotic use in the event of a rash or other unfavorable reaction. Nausea and vomiting. In the event of nausea and/or vomiting following surgery, do not take anything, not even plain water, until nausea has resolved. After resolution of acute nausea, clear liquids such as apple juice, jello, water, tea, or ginger ale can be tried. You should sip slowly over a 15-minute period. If nausea has not recurred, then bland solid foods such as cottage cheese are recommended for the next 6 to 8 hours. Pain medication may be taken after a bland food diet has been resumed. Once nausea subsides, you can begin eating solid foods. If you have nausea and vomiting that persist for more than 12 hours, please call the office. Other comments. If numbness of the lip, chin, or tongue occurs, there is no cause for alarm. Slight elevation of temperature immediately following surgery is very normal and not uncommon. Tylenol or ibuprofen should be taken to reduce the fever. Occasionally, patients may feel hard projections in the mouth with their tongue. These projections usually smooth out spontaneously. If not, they can be removed. The corners of your mouth may dry out and crack, and your lips should be kept moist with an ointment such as Vaseline. Sore throats and pain when swallowing are not uncommon. This will subside in 2 to 3 days. Stiffness, trismus of the jaw muscles may cause difficulty in opening your mouth for a few days following surgery. This is a normal post-operative event, which will resolve over time. The application of gentle moist heat to the facial muscles after the prescribed icing period will soothe the muscles and release the stiffness. Finally, sutures may be placed at the area of surgery to minimize post-operative bleeding and to help with tissue healing in the early post-operative period. Sometimes they become dislodged. This is no cause for alarm. Just remove the suture from your mouth and discard it. If non-resorbable sutures are used, they will be removed approximately 1 week after surgery. There will be a cavity where the tooth was removed. The cavity will gradually heal over the next month and fill in with new tissue. In the meantime, the area should be kept clean, especially after meals, with saltwater rinses or a toothbrush. A dry socket occurs when the blood clot gets dislodged prematurely from the tooth socket. Symptoms of pain at the surgical site and even pain to the ear may occur 2 to 3 days following surgery. Call the office if this occurs. Keep physical activities to a minimum immediately following surgery. If you are considering exercise, throbbing or bleeding may occur. If this occurs, you should discontinue exercising. Be aware that your normal nourishment intake is reduced. Exercise may weaken you. If you get lightheaded, stop exercising. Give us a call with any questions or concerns at 805-648-5121.